The prepper historian community deserves more than surface-level history, so let's start strong. If you're watching this, subscribe now, because what we're about to break down isn't recycled textbook material. This is the raw, largely forgotten trauma care knowledge that kept frontline soldiers alive when modern gear, clean hospitals and perfect conditions were nothing more than a fantasy. These aren't romanticized battlefield stories. These are the methods that real medics used under fire, techniques that can still teach us something today if we're willing to study them with the seriousness they deserve. So settle in, because the next few minutes will walk you through lost practices that shaped survival on the toughest battlefields in living memory. When we study how WWII field medics operated, the first thing to understand is that they worked with almost nothing yet were expected to perform miracles. Their training hammered one thing relentlessly: stop preventable deaths long enough to get a wounded man to real medical help. That meant mastering rapid bleeding control long before tourniquets were commercial products. Medics carried simple cloth tourniquets, but many didn't trust them fully because they loosened under movement. Instead, they used improvised strap-and-wind systems created from rifle slings, bootlaces or torn webbing, tightened using a stick or bayonet as a windlass. This wasn't theory, it was daily practice. If you want to apply that today, you train yourself to recognize materials around you that can take tension, you rehearse tying a windlass under stress, and you learn not to rely on gear alone. Medics didn't have the perfect setup, so they built reliability through repetition. Another forgotten method worth studying is pressure-based bleeding control. Modern preppers know the value of pressure dressings, but World War II medics made them work with crude supplies. They layered bandages with whatever absorbent material they had, sometimes wool, sometimes cotton, sometimes strips of uniform, and applied constant compression by tying additional strips of cloth over the dressing. The real secret was their insistence on aggressive, uninterrupted pressure. They knew that once a clot started forming, even a moment of release could restart the bleeding. Practically speaking, you can test this approach by practicing a no-lift pressure method when training with simulated bleeding kits. Field medics also revived a method many people overlook today: rapid shock prevention using positioning. Long before intravenous fluids were widely available, medics learned how to place a casualty so the body used gravity to maintain blood flow to the brain. They did this by elevating the legs, keeping the patient warm with jackets or shelter halves, and minimizing movement. The insight was simple but life-saving. Shock kills quietly, and positioning buys time. One of the most interesting and rarely discussed practices was infection control in environments where sterility was impossible. World War II medics cleaned wounds using boiled water when available, captured enemy dressings that were still sealed, alcohol from medical kits, and even iodine tablets crushed and dissolved into makeshift solutions. They understood something many overlook today. Cleaning early reduced the number of bacteria that entered the wound, giving the patient a fighting chance before antibiotics could be administered. Even now, if you're outdoors and dealing with a wound, the principle remains the same. Reduce contamination early using the cleanest water you can produce, then protect the wound from further exposure. This is not a replacement for proper medical care, but a time-tested method to delay infection when options are limited. Another secret that speaks directly to preppers is how World War II medics managed pain and panic without the luxury of modern pharmaceuticals. They were trained to use calm, direct communication as a tool. Steady voice, short instructions, unwavering presence. This psychological steadiness helped prevent shock, reduce thrashing, and improve the patient's chances of survival. One method seldom mentioned outside specialist circles is splint improvisation. When bones snapped under artillery blasts or falls, medics fashioned splints from rifles, entrenching tools, tent poles, saplings, or even stacked magazines wrapped with cloth. They didn't worry about elegance, they cared about immobilization. For a modern example, you might take a trekking pole, 2 straight sticks, or even, say, a sturdy rolled-up jacket, align it along the injured limb, and secure it with belt scarves or tape. The core principle really hasn't changed. Immobilize above and below the injury and avoid unnecessary movement. What may surprise many is that these improvised splints often worked just as well as issued ones, simply because the medic knew the anatomy and the goal. Finally, we should talk about the quietest but most powerful skill World War II medics carried: triage discipline. They had to decide within seconds who could be saved and who could not. Their secret was ruthless focus on survivability. They checked breathing, bleeding, responsiveness, and likelihood of evacuation. It wasn't coldness. It was the only ethical way to save the most lives. These methods aren't museum pieces. They are practical, resilient approaches forged under pressure. They remind us that real preparedness isn't gear. It's skill, discipline, and understanding how the body fails and survives. If you've learned something valuable today, be sure to subscribe to The Prepper Historian and share this video with others who take history and survival seriously. This knowledge is worth preserving, and together we can keep it alive.